You're tuned in with Jsanews. In today's segment, we will be discussing health disparities. In today's society, eliminating racial and ethnic disparities in healthcare is essential when it comes to providing residents with affordable health insurance. It should be no discrimination to any patients, no matter race, gender, ethnic origin, age, and disability. All patients deserve high-quality health care. Our society is becoming more racially and culturally diverse. It is the job of our physicians today and all staff who work in the health field to become more diverse culturally and strengthen their language due to the health literacy among ethnic and racial minorities. Such initiatives as cultural competency training should be incorporated when joining medical schools or when taking practice in any health field to improve cultural awareness and sensitivity. To sum things up, healthcare delivery should be revised to ensure patient-centered medical care is easily accessible to racial and ethnic minorities, and that physicians are provided with resources to deliver quality care. Now on to Jasmine.
Thanks, Shakima. In today's news, the education level of all minorities needs to be strengthened, especially in subjects such as math and science. The ACA supports policies that allow institutions to consider race as a factor in admission to medical schools. Minorities should be holding more positions in authority. Amongst racial and ethnic minorities, the social determinant of health is a huge health disparity. Coming up at 6 p.m., Akila will speak on health disparities. I'm Jasmine Herbert. Thank you for watching.
I am Akila Ellison. Today we'll be exploring the effect of the ACA on disparities. Minorities today have great difficult access and need of health care services. The ACA is the most single transforming factor driving change in healthcare since the late 50s. Many are saying that the disparities in the quality of care is different because of the racial and ethnic groups. Because it is hard to keep track of someone who is uninsured, many healthcare providers are starting to say that their jobs are the most difficult in the nation. Because of the decision whether it's the quality or the cost that will be affected. The evidence regarding health disparities is the intent to reduce coverage in clinical care. You may ask yourself, what is healthcare disparities? What is the difference in health and healthcare between population and groups? Why does it matter? It limits the improvement in the overall quality of care in population health and results in unnecessary costs. The key initiative that is taking place is to address the disparities in reducing racial and ethnic health disparities. The ACA impacts healthcare disparities by the effort to reduce disparities and improve healthcare for vulnerable populations.
I'm Jackson with Jsanews. The relationship between disparities, access, cost, quality, HIV and AIDS, and the healthcare system relate to one another in many ways. Disparities that people typically suffer from are not being able to afford health care coverage, access to care, and the use of care. Due to these disparities, people tend to become ill without knowing. HIV and AIDS is one of the largest health disparities in the African American community. No access means no health updates. Statistically, minorities are in a poorer health status than any other ethnic group. The great health care equals access, quality, and the means to afford it. If more people had access, then there would be control on the spread of HIV and AIDS. This is where the ACA comes in. It is designed to provide affordable health care to uninsured Americans. The act can prevent health issues and also some of the disparities.
Good evening. My name is Alexis, and I'll be covering the Iron Triangle. Did you know access, cost, and quality is also known as the Iron Triangle? Well, it describes the relationship among each of these three categories. The Iron Triangle affects many different institutions such as businesses, policymaking, and healthcare. Quality is the value, efficacy, reliability, and outcome of care being delivered. Access refers to how long it takes to get an appointment or how long you spend in a waiting room. Unfortunately, experts measure the systems and not personal experiences. Cost affects the people, whether they are employers, government agencies, constituents, or insurance providers. Costs will also continue to rise, and it will lead to affecting access, in which access will then impact quality. Making healthcare more affordable would increase, but it would also decrease its quality of care. If you increase the quality of the healthcare, then it would increase the cost and create a limited access to it.
Today's segment, we will be promoting healthy relationships. Did you know that African Americans are the racial group that's mostly affected by HIV? No, I bet you didn't. The rate of new HIV infections within the African American community are that of 8 times higher than its white counterparts per population size. Gay and bisexual men account for most new infections among African Americans. But there are ways to prevent this. Be in love with one another. Have a monogamous relationship. Don't cheat and don't step outside of what you know. Wrap it up. Use condoms. Have safe sex. Don't have unprotected sex. Go on a clinic date. Get tested together so that you know each other's status. And last but not least, play it safe. Know your partner enough to trust them with your life.
And that is all for today.